The following will be the same dictation, but at 160 words per minute for 5 minutes. Ready? Question. Are you duly licensed to practice in Alaska? Answer, I am. Question, and you are a graduate of what medical school and the year? Answer, Fairbanks Medical College, 1965. Question, do you specialize in any branch of medicine? Answer, yes. Question, in what? Answer, internal medicine, hematology, and industrial medical diseases. Question, now, doctor, you were here and you heard the hypothetical questions propounded by Mr. Talbert to Dr. Grittner. Answer, I did. Question, and at the instance of the carrier in this case, did you read the testimony of Dr. Holden? Answer, I did. Question, at the instance of the carrier, did you see the hospital records in the case? Answer, I did. Question, did you see the report of Dr. Gould, the claimant's consultant, of April 2, 1989? Answer, I believe I did. Question, doctor, I want you to assume then, in addition to the other data that was contained in Mr. Talbert's question, this further information that the claimant was first seen by a Dr. Ross in February 1988, who treated him for essential hypertension and kidney disease. Assume, in addition to the question, that there was no nausea until October or November 1988. Further assume that the exposure to carbon tetrachloride in this case was prior to October or November 1988 and very spotty at times. That there was no exposure at all for 2 or 3 months, but at one time there might have been an exposure for a week or so while cleaning machinery. Having assumed that, I would like to ask you, have you an opinion as to whether or not the condition which this claimant has been found to have is related to the exposure to carbon tetrachloride as outlined to you, either directly or indirectly? Answer, yes, I have an opinion. I see no evidence in this record that would show that carbon tetrachloride has either produced this man's disability or aggravated it. Question, will you tell us, doctor, from your recollection of all the facts in the case, some of your reasons for coming to such a conclusion medically? Answer, all the evidence in this case points to the fact that this man had hypertensive vascular disease. Carbon tetrachloride, from my experience and from my knowledge of the literature, produces no primary cardiovascular disease. There is no evidence in any of the examinations of either his physicians or the hospitals that he had nephrosis or the type of nephritis that you get with carbon tetrachloride. He was advised to have a sympathectomy and did have a sympathectomy. A sympathectomy is never done for a primary kidney disease. It is done for a primary vascular disease, usually if the kidney is not severely involved, or occasionally where the kidney may be secondarily involved with hypertension. Finally, in my experience with carbon tetrachloride patients and my knowledge of the literature, if a patient has a kidney involvement due to carbon tetrachloride, whether it is acute or chronic, at least in no industrial case that I know of is there an exception. They either die quickly or recover completely. I know of no case on record in my own experience or in the literature where kidney damage due to carbon tetrachloride, once a patient has gotten over the acute phase, has persisted and become chronic. Certainly the incidence that Dr. Grittner testified to is not in the literature and is not in keeping with any of the experiences of industrial medical students. These are some and perhaps the main causes of any of my reasons for my belief that this carbon tetrachloride had no relationship to this condition. Question, doctor, in your opinion, does exposure over a period of time or one large episode of carbon tetrachloride exposure persist and cause eye damage? Answer, the only eye damage that I know of that can be produced by carbon tetrachloride is secondary to the nephritis and hypertension. Question, is it your opinion, doctor, medically, that stout people or hypertensive people are more susceptible to carbon tetrachloride poisoning either over a period of time or a single episode? Answer, I have never heard of any evidence to show that. Question, is it true, in your opinion, doctor, that exposure to carbon tetrachloride can cause sinus trouble? Answer, I certainly do not think that would be a prominent feature of it. Any person who has any irritant, regardless of what it is, may have an aggravation of sinus trouble. He usually has the sinus trouble primarily, and that may be aggravated. In my experience, I do not know that that is a frequent cause. I do not have any experience with any of my patients where that was the primary cause. Question: is it true, doctor, that a man who does sustain kidney damage as a result of exposure to carbon tetrachloride will have presented to him symptoms that cannot be ignored? Answer: of course. That concludes 5 minutes. We ran a few seconds over, but I did a few words over at 160 words a minute.